You mentioned a little bit with flexibility, but talk to me about burnout and maybe how this helps to mitigate burnout.
So think about what physicians and AP providers went through during COVID. The amount of time that the patient loads were enormous. The stress on physicians enormous. It took a toll. So even if you look at what Harvard School of Public Health identified back in 2019 or before the pandemic, they were talking about how that this had become physician burnout had really become a public health crisis, and it only got worse as COVID continued. So 80% of those that we surveyed said that addressing feelings of burnout was one of the reasons that they chose to work locum tenens. So locum tenens is keeping physicians in the workplace longer, in the workforce longer, and that might have otherwise have burned out and retired. So the fact that they can work locum tenens is helpful. But again, it's not the answer to all the problems that we have with physician burnout.
Okay, so, if you had a magic bullet there, what is the answer?
I think it depends on the facility and the system, but what we do find is that physicians and APPs that we surveyed, um, they would go back to a permanent position if conditions were such that they could have a more flexible schedule. So remember what we said at the top of the call, and that was around feeling of needing flexibility, that they wanted to have more balance in their lives, and coming through COVID, where so much was put on them to attend to a very difficult situation. Now you find that if healthcare systems and those that are allowing more freedom and more flexibility, that are certainly even looking from a compensation standpoint and other conditions to be more favorable, they would continue working in those permanent roles. They just need to see an improvement in their daily work experience. So as we think about improvement that can take place, reducing some of the bureaucracy and let physicians be physicians, that's part of it. But the other part is to make sure that we've got a very good mix. So retaining physicians, retaining advanced practice professionals, having nurses and other healthcare workers, where you've got the right complement to make sure that the ongoing challenge that is causing some of the burnout for these physicians and AP professionals, we need to make sure that they have a very good work experience, and that will certainly help keep physicians in practice longer.